Welcome to Mental Health Mini number 10, Ethics in Psychiatric Nursing. Before we get into the ethics of psychiatric nursing, we have to understand the concept of vulnerable populations. A vulnerable population is a group of people that are at high risk for being stigmatized, abused, or excluded from necessary health services, social services, and financial services. A lot of times this is impacted by having low socioeconomic status, low education and ability to advocate for oneself, experiencing stigma, and lacking understanding. And this is why we have special precautions to protect these patients. One of those special precautions is practicing nursing ethics and values. Examples of vulnerable populations are the elderly, children, and those with mental illness. And that's why it's especially important that a nurse working in a mental health care setting really practices their nursing ethics and values so that we can protect them from some of these exclusions. Ethical principles are going to be standard across the field of nursing. However, we can apply them differently in different situations, and different healthcare settings may have certain principles that are harder to enforce than others. So for example, in psychiatric nursing, we have the ethical principle of justice. Beneficence is to do good for your patient, whereas non-maleficence is to do no harm. There may be situations where the actions that we have to do in psychiatric nursing may be considered harmful to a patient. One perfect example of this is putting the patient in restraints. We wouldn't put a patient in restraints unless they're posing a significant risk to themselves or others, and all other avenues of trying to address that have been tried. However, it still may cause emotional harm to that patient. When we are considering this, we often believe that the ability to have a positive outcome and to help protect the safety of that patient does more good than it does harm. So that's one example of an ethical principle that may be conflicting in psychiatric nursing. It is also important that nurses hold themselves accountable for their actions and that we practice fidelity. So fidelity is doing what we say we're going to do. This is really important in psychiatric nursing because a lot of our patients may have had relationships or situations that have made it hard for them to trust others. And they may bring that into the healthcare setting and they may have a hard time trusting the nurse. It's essential that we establish that trust and rapport with our patients so that we can maximize our therapeutic use of self. And so fidelity is going to be a very important principle for us to practice. Autonomy is another one that can be difficult in psychiatric nursing, and that's the right for someone to make their own decisions. In psychiatric nursing, a patient may be on a court order for treatment or involuntarily admitted. So they're receiving treatment that may not be their choice. It may be against their will. It is something that legally we have to follow. So as nurses, we have to find a way to try and maximize that autonomy and still meet our legal requirements. So instead of saying something like, I have your medications, would you like to take them? We can say something like, I have your medications, would you like to take them in the morning or the evening? And give them choices to try and optimize that feeling of autonomy. And then lastly, veracity is telling truth, and that is a similar principle to fidelity in the sense that it's going to be important that we practice that so that we can establish rapport and trust with our patients. Nursing values are similar, and we can also apply those to our psychiatric nursing practice. This is going to be examples like altruism, which is channeling our energy to do good for others. And it's going to be important that we really try and do good and try and help our psychiatric patients. Autonomy, we also talked about already. We can practice with human dignity. A lot of patients may never have experienced true human dignity and respect due to the stigmatization of mental illness. We want to practice with integrity and honesty, as well as social justice. And then we want to help maintain privacy and confidentiality whenever possible. This can often be conflicting because there are certain situations in psychiatric nursing practice where we do have to break confidentiality. And this is called duty to warn. We ethically have a duty to warn someone if our patient has a viable threat against them. This often does break confidentiality, and it's the only situation in which we can do that and still be ethically sound. Some common ethical dilemmas that you may see in psychiatric nursing include things like involuntary admission, use of restraints, and court order for treatment. The reason why these are ethical dilemmas is because they're against the patient's will. However, they are used to help optimize their health and benefit them by keeping them safe. We already talked about the breach of confidentiality with the duty to warn. Another one is the right to suicide, and that is the choosing one's own death. And this is a very popular ethical dilemma in healthcare right now as people are starting to consider dignified death. And then lastly, we have guardianship. So a guardian is someone similar to a durable power of attorney where they are purposed with the task of making healthcare decisions for the patient. The reason why this becomes an ethical dilemma is because often it's a court-appointed guardian, which is a lawyer. In the court-appointed guardianship, when it is a lawyer versus a family member, that lawyer may not know the patient well enough to truly know what's going to be best for that patient. They may also not have a lot of knowledge on healthcare, and so they may not be making the most sound decisions for that patient. And then lastly, we have stigma. And the reason why I include stigma is because it's something that really contributes to patients and their experience of vulnerability. There are two different forms of stigma, and they lead to a phenomenon called label avoidance. The first type of stigma is public stigma, and this is endorsement of negative stereotypes either by the media, through the entertainment industry, or in the healthcare field. And it's the belief from the public that someone is less than because they have a mental illness. So in media, if you search it, a lot of times if a patient is involved with something that has a mental illness, that's going to be labeled the cause for why they committed a crime or why they were involved with a certain incident. In entertainment, someone with a mental illness is often portrayed as being crazy, unstable, or violent, which is not the case. And in healthcare, it's really easy to say certain things like, oh, that patient's a difficult patient because they have a mental illness. So those are examples of public stigma. Self-stigma develops as a result of public stigma, and it's when the person sees themselves as inadequate or incapable of something because of their mental illness. So it may be someone saying, oh, I can't go back to school. I have depression. I won't be able to succeed. Label avoidance is the phenomenon that comes out of stigma, and that's when people avoid healthcare due to the fear of being identified as mentally ill and experiencing the stigma that is often portrayed to those with mental illness. And that wraps up our mental health mini.